Can you drive if you have absent seizures? Imagine being behind the wheel and suddenly losing awareness for a few seconds. That's what can happen during an absent seizure. These seizures are brief episodes where a person may stare blankly and seem unresponsive. Because they involve a temporary loss of consciousness, they can be dangerous when driving. Most laws around the world say you can only drive if your seizures are fully controlled and you have been seizure-free for a certain period. This period usually ranges from 3 to 12 months. For seizures that affect awareness, like absent seizures, many places requiring at least a 12-month seizure-free interval before you can legally drive. Some regions might accept a shorter period of 3 months, but this depends on local rules and your doctor's advice. The reason for these rules is that even though absent seizures are very brief, they can happen unexpectedly and cause lapses in attention. If you are driving and have a seizure, you might not notice what's happening around you, increasing the risk of accidents. That's why medical professionals carefully evaluate how often seizures happen and how well they are controlled before giving a green light to drive. They often ask patients to inform their local driving authorities about their seizure history. Medication plays a big role here. Anti-epileptic drugs can help control seizures, but sometimes they cause side effects like drowsiness or difficulty concentrating, which can also affect driving safety. It's important to discuss these effects with your doctor to understand whether it's safe for you to drive while on medication. Driving without proper clearance or against medical advice can have serious legal consequences if an accident occurs. It's always best to follow your healthcare provider's recommendations and local laws to keep yourself and others safe. Remember, each person's situation is different. Some people with well-controlled absent seizures may be able to drive after meeting the required seizure-free period, but others might need more time or additional evaluations. In summary, you can drive if your absent seizures are under good control, and you have been seizure-free for the legally required time. Because these seizures involve quick lapses in awareness, it's crucial to follow medical advice and legal guidelines. Always consult your healthcare provider for personalized guidance, and never assume it's safe to drive without proper clearance. Your safety and the safety of everyone on the road depend on it.